Hello and welcome to Seattle City Makers. I'm your host, Jon Scholes. Well, welcome everybody to our latest episode where I sit down with Jeff Sperring, Dr. Jeff Sperring, that is. Dr. Sperring's the CEO of Seattle Children's. He was named to that role in 2015. Prior to taking the helm at Seattle Children's, he was the CEO at Riley Hospital for Children in Indianapolis, Indiana. He was also the hospital's chief medical officer, associate chief medical officer, and director of pediatric hospital medicine there. He holds a bachelor's degree in biology from Emory University, attended medical school at Vanderbilt University, and was a pediatric resident at the Naval Medical Center in San Diego. He was asked recently by Parent Map magazine what the CEO of a hospital does, and he described it as being the number one fan of the most amazing 8,000 team members he could ever work for. Today, he leads an incredible 100-plus-year-old Seattle institution that was founded by Anna Kleiss following the death of her young son. And even with all the resources Anna and her family had at the time, they found they weren't able to get the care they needed for their young son. And so she was inspired following the tragic death of her son to tour the few children's hospitals that existed in our country at the time, back in Philadelphia and San Francisco. And she returned shortly after and along with more than a dozen women in our community, founded Seattle Children's in 1907. They started with 5 beds in downtown Seattle at Fifth and Marion. Those were leased from Seattle General Hospital. And then shortly thereafter developed their own building to serve kids on Queen Anne. Today, Dr. Sperring leads this institution, and we discuss the scale and focus of the Research Institute that's part of Seattle Children's, the often underappreciated aspect and focus of Seattle Children's, a significant pediatric research institute that is proud to call, and we're proud to have them call, downtown Seattle home. They've got a number of buildings along Stewart in downtown Seattle, and today is the 4th largest pediatric research institution in our country. We discuss their operations and their area of focus and some of the things their researchers are focusing on. And we discuss the state of kids today post-pandemic, the state of their mental health and their physical health. We discuss Dr. Sperring's approach to leadership, his first job, and of course, our standard question, his perfect Saturday in Seattle. I hope you enjoy my conversation with Seattle Children's CEO, Dr. Jeff Sperring. Well, thanks for making time in your busy schedule to do this.
Yeah, thanks.
Appreciate you coming on the podcast. And maybe we just first start with, for those who don't know where we are. We're downtown in one of your research facilities.
Yeah, welcome to Building Cure.
Exactly. Cure. What happens here?
Yeah, so this is Building Cure. So it is our third research building here on our downtown campus. We broke ground on this in late 2016 and opened in 2019. So above us, 13 floors, obviously about 10 floors of research going on in everything from pediatric cancer research to child development to immunology. And then the top 2 floors are where our GMP facility are. So in scientific terms, good manufacturing process. So it's where we're able to actually manufacture our own cell and gene therapies, which is really a little bit unique for children's hospitals. We kind of decided that when we built this building, we wanted to make sure we could do that on our own because typically kids get kind of left behind in clinical trials, don't have the same access to that. And so we wanted the ability for our scientists not only to discover something, but able to actually build it, manufacture it here so we can go directly into clinical trials.
So this is one of a number of buildings and facilities you have downtown. Obviously, Seattle Children's is well known in our community, maybe though more so for the hospital versus the research function, which I think is one of the wonderful undertold stories as far as what's happening downtown, but also obviously in the city. What's the footprint beyond this building of what's happening under the umbrella of Seattle Children's from a research perspective downtown?
Yeah, no, I think that's exactly right. I mean, one of the things that we try to make sure to tell the stories, everyone, when you talk about being at Seattle Children's, they know the hospital has been there for 116 years and obviously so many families in generations that have been connected to the hospital. You know, the research story for us is still relatively new. We've only been a research institute for about 16 years. But what's amazing, unprecedented kind of in the country, we went from being almost non-existent existing as a research institute. Now we're the 4th largest dedicated pediatric research institute in the country. Last year, we just passed St. Jude to kind of take the number 4 spot for institutes that are just dedicated to pediatric research. So
and because we're competitive in Seattle, who's ahead of us?
And because we're competitive, so Boston, Philadelphia, and Cincinnati.
Okay,
we're on our way. But it's a great example of this incredible community supporting Seattle Children's, not to just think about what's possible and what kind of groundbreaking care we can do now, but where is the next pipeline of cures for kids for diseases that we never thought possible. So this building alone, Building Cure, is about 500,000 square feet. It doubled the capacity that we had. So we now have about 1 million square feet of research here in downtown Seattle in this amazing life sciences kind of innovation kind of corridor. And again, now the 4th largest in the country, thinking about pediatric diseases all the way from cancer to epilepsy, autism, diabetes, across everything. So every day I've got more than 2,000 team members coming in here every day thinking about not only how do we advance pediatric care, but how do we actually bring cures to things that we've all thought about for a long time.
And even moving some more people down here from the campus and facilities in Laurelhurst, just because you've got space needs to grow into space there with your clinics and take advantage of the space you have downtown. So we're actually seeing more people downtown now from the research side. Is that right?
Yeah, it's kind of a good story both ways, right? So we've been able to find this amazing space downtown and obviously grow this research program. But as the hospital has also continued to grow, we are running out of space up in Laurelhurst. And so what we've really tried to think about is we want that really to be about team members that need to be doing patient care. It's where our patients and families are. If you're doing administrative roles or other things, we're actually able to move into more of our space here downtown. So to your point now, we've got our foundation philanthropy teams, a lot of our marketing, HR, some of our legal teams, some of those services are now down here. So we've really created kind of the downtown campus for Seattle Children's beyond just the research program.
And I think those numbers of you employing 2,000 or so people it's got to make you one of the top 20, if not higher, employers downtown as far as number of folks employed. So.
Yeah, that's exactly right. It's over 2,500 when you start adding in some of those administrative things. So yeah, and if you
keep
look,
them coming.
Yeah, I know we love it. And again, I mean, you came here, and I think again for us, what's great about all of our work, right, is we want to make sure that we're connecting our team with the work that we do. I love coming down here, being able to kind of interact with the team here. But you think about so many of our team members and being able to come and see what's going on in the research and understanding that the work that they do every day is not just taking care of kids today, but really being the pipeline of cures for pediatric disease. And you get to be here in this space and be able to do that. And what we are all appreciating is just a stronger and better downtown all the time.
Yeah, we're moving in the right direction.
Absolutely.
And those are jobs you kind of can't do from home, right? So
no, it was the other, we are a little bit of a mixed model. We always talk about obviously direct patient care in science. You can't do that remotely. That is hands-on work, in space, collaborative work that we really need people together. For a lot of our administrative functions, we, like all companies, we went very heavily remote in the early parts of the pandemic, and we're starting to bring people back now in kind of hybrid mode. So we're starting to see more and more of our team members here together, which I think is a great thing for all of us.
And you've got a little bit more room to grow. You mentioned the surface parking lot you all own just next to this building, so potential future growth to accommodate more demand for more research in Seattle.
Yeah, no, that's exactly right. I think, we're looking at obviously where we can continue to grow kind of on our own campus. And then we've just signed a lease for another life sciences building that's just across the street from the parking lot. Because again, even with this new building, we are filling it faster than we even imagined, which is a great thing and a lot of success. So we're already thinking about where the next sites can be for us to expand and grow.
And I imagine a good portion of your growth is driven by significant expansion of NIH funding over the last 5 or so years. What's that meant for Seattle? What's that meant for Seattle Children's Research Institute?
Yeah, that's exactly right. So, we've now gone, so last year we're over $200 million of external funding, almost $140 million of that directly from the NIH. So, we're seeing our teams and our scientists continue to bring in more federal money through those grants, specifically dedicated for kids. What's been great, we're a little bit biased when it comes to pediatric research. So a quick diversion. Kids make up such a small part of federal funding for research. So as an example, National Cancer Institute, of all of the funding that the National Cancer Institute gives out to cancer centers for research, only 3% of it goes to kids. So we're dealing in a really competitive field for the small dollars of NIH that are going to kids. We want to make sure that we're bringing that here to Seattle and that we're obviously growing for cures. But the benefit for us is we get to do it again again, in this corridor with the Fred Hutch and our partners there, the Allen Institute, UW-Medicine. So again, what I love about being here is not only what we're able to do that for kids as part of Seattle Children's, but the collaborations and the innovations that we can do with our partners just continues to make us stronger for that.
What does that look like for folks who don't kind of have visibility into how these major institutions in Seattle work together? I mean, we have awareness of Seattle Children's and Fred Hutch and Cancer Care Alliance, I think now renamed, right? And what does that mean on a day-to-day and how you're trying to pool resources, efforts, brain power to find cures?
Yeah, no, it's exactly right. So, I mean, as an example, UW-Medicine, great example of where our faculty that are here, in Seattle Children's Research Institute doing their work, all have their faculty appointments at the University of Washington, our postdocs, our students. This becomes a great opportunity for them to get their education, further their training in pediatric research, but doing it as part of UW-Medicine. And the Fred Hutch is a great example as part of that reorganization of the SCCA last year. We reorganized our research affiliations, so we now have a formal research affiliation agreement with the Fred Hutch. So our pediatric oncologists are now members both of the Seattle Children's Research Institute, but the Fred Hutch, also the Fred Hutch. And so able to do those collaborations as we think about where cancer science might benefit both kids or adults, how do we find those ways that we're actually able to share those learnings?
What's some of the research you're doing that gives you sort of the most hope, or things that we're close to when it comes to pediatric research? What are we on the cusp of that is significant?
Yeah, I mean, I think obviously like cell and gene therapy is something that we are all very excited about. And I think it really, again, ultimately comes back to it's the speed at which we'll be able now to discover where there is either a gene or, again, some cell defect. But it's not just like learning what the issue is. It's being able to quickly turn that into a clinical trial or actually into a product. One of our scientists has a great example. He studied a specific childhood disease for a long time. He was one that discovered the specific genetic defect, more than 20 years ago. But it took a long time to get to the point that there was actually a gene therapy that we could actually put into a clinical trial. We can squeeze that 20 years now down into a couple of years. And even the COVID pandemic was a great example of all of a sudden brand new novel virus and how quickly we were able to turn that into a vaccine. And so what we're really excited for now is for so many rare pediatric diseases, we can discover where the issue is, but the ability to more quickly turn that into a clinical trial or actually a potential therapy is, I think, over the next 5 to 10 years, what's really going to be exciting to see.
You mentioned COVID, and I wanted to maybe get your take on, what's the state of kids today, sort of post-COVID, their mental health, physical health, but I think, we're all sort of seeing, hearing, feeling the effects of the pandemic on the mental health of kids. How would you summarize sort of where we sit today from your vantage point?
Yeah, no, it's a great question. And I think we've, tried to be, we've talked about, we'll all think about when we talk about the pandemic, in our kind of how it impacted us, we'll think about, 2020 to 2023. What we've talked about for kids is the impact for the pandemic really is just starting now. And it's because of mental health. As much as they didn't get necessarily as clinically impacted by the virus, we didn't see the same kind of rates that you saw in adults and specifically older adults, really have seen an acceleration of concern around kids' mental health, number of kids presenting in crisis because of that. Some of that we were already seeing before the pandemic. The trends were worrisome before that, but absolutely accelerated through that. And, as we know, just the level of disruption to their lives, being out of school, lack of kind of their normal social supports, unfortunately, sometimes exposure to, issues at home where historically kind of school was their relief from that and other issues. We are really seeing that. So, even today, every day, we have kids that are in our emergency room just waiting for inpatient psychiatry beds because there are more kids in crisis than any of us have capacity in this community. So thankfully, where we didn't see some of the impacts of the virus specifically for kids, we certainly are seeing some of those long-term impacts because of mental health.
Do you attribute it to just like the disruption of the rhythm of life and structure, remote school versus in person? Do we know yet what is sort of led to these high rates of inpatient admission and eating disorders and other mental health challenges that our kids are facing?
Yeah, no, it's a great question. Again, kind of almost comes back to why we're in this building here, is that we have teams that specifically
are on the case.
are studying that and looking at that. And they were doing that all the way through, through the pandemic, really trying to understand like what is the real cause. Again, as we were seeing some of that trending, unfortunately, even before the pandemic, but there certainly is kind of multi-factors, certainly the disruptions of their normal routines, whether that was, not being in school or again, loss of that social connection to some of their friends or grandparents or other extended family members that historically they didn't have. We know that social media clearly played a role in this as well, probably seeing that already, but again, with more isolation, more screen time, probably not as positive for kids and their mental health as well. So multiple factors coming together. But again, we've got teams that are actually doing that research and really trying to understand that now.
Do you think it changes how we may manage the next pandemic, should there be one in our lifetimes? Do you think we take a different perspective on potential long-term impacts to kids and others? I mean, adults are dealing with a lot of similar issues.
Yeah, no, I mean, I think like always, and obviously we're both in healthcare and in science, you always should learn from what you went through and try to figure out how do you do it better. So I absolutely think we do, because frankly, if we don't, we've failed. I think to your point, I think what we will have to balance, and it's sometimes easy now to kind of sit today and kind of talk about that and knowing what we're seeing about things, but we also remember at the time worrying about the safety of our parents, our teachers, other kids, and were they going to get exposed? And so I think there was a lot of great, obviously discussion and best of what we knew at the time around, what is going to be the impact. I absolutely think we would do it differently going forward. But I think, again, that's why we really want to understand what those impacts were so that we can do that. And again, we're coming together with our other children's hospitals. We're now part of what's called a pandemic coordinating network. Actually, not only ourselves, but with 5 other children's hospitals in the country doing that research, but then also thinking to your point about how do we respond differently? How do we set up structures and networks to be able to do that in a different way?
And I saw that you just recently took over the leadership post of the Children's Hospital Association in the U.S. What are some of the issues that association and under your leadership are grappling with taking on as you coordinate and affiliate with other children's hospitals around the country?
Yeah, no, it's the great thing is we're a pretty small family when it comes to children's hospitals around the country. We know each other well. It's a pretty incredible honor to be able to chair the CHA board and do that. I think in some ways it's a little bit reassuring that what I'm hearing from our colleagues are the same things that we're going through. So it's not like, wow, we're there's something really unique about what's happening here in Seattle. It's children's mental health, it's workforce for healthcare for the long term, and it's really about health equity and how do we make sure that all of our kids have not only access to care, but are actually getting the same types of outcomes. We're limiting disparities. Those are the big focuses for us right now in that. And again, very similar to what we've prioritized here at Seattle Children's, but trying to make sure that we're all learning and collaborating together so that we can all get better as we do that work.
How do you respond to the increases in demand when it takes so long to develop your workforce? It's not that you can just put somebody through med school or residency and have them, in a psychiatric clinic providing treatment within months or weeks. So, I mean, how do you manage the increased demand against the capacity you have and the long-term investments and the amount of time it takes to develop your workforce?
Yeah, I mean, that's one of the biggest challenges we have as we continue to see the number of kids that need our care. And to your point, you can't fix that in just a couple of months. Yeah. It really is about pipeline. And so how do we make sure that we're continuing to build those training programs? And so, I think we're looking at it as kind of a combination of two. One, we've got to make sure that we've got that pipeline of this next generation that's going to be excited to go into healthcare, loves the idea of that. I think the pandemic, was a little bit of a mixed bag for that, right? There was this sense of frontline heroes and what are we doing? But then people really saw the fatigue of it. And obviously, it's hard. I mean, healthcare is hard work every single day. And so we want to make sure that we're getting kids excited about the pipeline. And then we're also going to have to just change the roles. Like, we are not going to solve this by just doing the same thing and having more people doing it. And so again, how do we use technology? How do we use other innovations to reduce some of the burden for our team team that are just doing the work day to day, so they can focus on what they did go to nursing school and medical school or went and got their PhD for, and alleviate some of the burden on the other pieces of it. So, for us, that's really a lot of what we're focusing on. Things on the clinical side, like, the electronic health record, which has so many positives, but is a huge burden for our team, filling that out and doing that. So again, how do we actually improve the technology in that interface so that they're spending more time directly with, people that they're there to care for?
What do you foresee, generally in healthcare, not specific to kids, as kind of the most disruptive force coming down the line when you think about the healthcare system generally?
Yeah, it's a great question. I hate to jump on the AI bandwagon like everybody else, but there's a lot that I think we're excited about what that could potentially mean, in healthcare. Again, all the way from what the impact could be on clinical care, reducing burden for some of our clinicians and providers because it's able to take care of some of the other tasks that, frankly, they spend way too much time doing now. But even here in the research building is a great example. So, so much of what our experiments are understanding where there may be an issue and then having to run the same experiment over and over again until you really understand what's going to work. And we're already seeing, the potential benefits of, instead of having to do that in, animal models or protein models, like AI actually being able to run those simulations for us at speeds and scale that we could never imagine, and actually helping us identify better therapies and better targets. So that's one of the things that we're really excited about. Again, I would say openly for us, cell and gene therapy is really an interesting idea for us because of, again, how quickly now we think we are going to be able to go from truly understanding what the issue and the pathway was and being able to come up with the therapy for that.
So AI on the research side, but also on the care side, and different applications and different potential benefits.
Yeah, no, that's exactly right. Yeah, again, thinking about, there is a lot in healthcare that is about pattern recognition, understanding this combination of these symptoms, these things, what should I be looking for? Looking at, large quantities of lab data, as a pediatrician, right, in medical school, you get the 5 sheets of lab data and it's like, okay, this combination of these outcomes, what diagnosis should I be thinking in my head? And understanding that at some point there may be a way to help us kind of, Copilot augment that a little bit so that we're consistently and repetitively and being able to reliably be able to get to that.
What drew you into medicine and then pediatrics specifically? And then how did you make the move from practicing to leadership positions in healthcare?
Yeah, it's one of those life things. I was one of those kids that wanted to be a doctor when I was in 6th grade. So for me, it was something that I always just thought I wanted to do, and it was really, again, out of this sense that I wanted to help people and I wanted to make a difference, and had a little bit of exposure through one of my elementary school teachers to someone who was going through medical school. There are no other doctors in my family, so this was not like I saw this in my family, but just really thought that I wanted to do that. And as I got into science, really fell in love with the idea of science, but more importantly for me, like how I could use it to actually like make a difference for someone and provide that care. And so really always wanted to do that. Went to medical school at Vanderbilt and did all of my rotations. And, first day of my pediatric rotation, I was hooked. That was it. No doubt for me that that's what I wanted to do. And so finished medical school, did my training in the Navy in San Diego, and then spent 14 years in Indianapolis as a pediatrician, taking care of kids in the hospital. So loved the clinical side of my career, loved building those relationships. I've said the story in other venues. I still get letters from patients that I took care of, years and years ago. And so that for me is the most fulfilling part of this. I didn't choose to get into hospital administration. I never had any plans to do this at all. It was really more along the way, got asked to do a project or a role and did that, and something else would come along and I just kept saying yes. And eventually someone asked me to be the CEO at a children's hospital in Indianapolis, and really enjoyed the ability to think about this broad impact on children's health. And then the Seattle Children's job came open 8 years ago. And that's, one of those dream jobs that I thought, well, I got to take a chance. I have probably no chance of getting that job, but got to take a run at it, and was incredibly thankful and grateful that I've been able to be here.
Had you spent much time in Seattle before you took the job 8 years ago?
A little bit of time, not very much. We don't have family connections at all. Obviously, through both the Navy and other things, new friends and colleagues that had been here and loved the area, had been out here for a few meetings. Obviously, knew the reputation of Seattle Children's, but no, it was a new area for us to live, and we absolutely love it. This is home for us now for the long haul. So yeah.
What was what's changed about your sort of early impressions to now being here 8 or so years?
Oh, that's a great question, John. I mean, again, I think what we fell in love with, again, that combination of both, obviously, just the natural beauty and geography, but again, such a kind of a great combination of vibrant downtown that we love coming to, but then all the unique kind of individual kind of villages. We live in Ballard, which is where we started renting when we first got here 8 years ago, and kind of fell in love with it, and ended up buying a house there. And so love that idea of having kind of our village, where we get to kind of walk to the movie theater and walk to restaurants, but then, with transit and other things, are driving down, close access to Seattle and downtown. So, we've loved that ability to do that. And then not too far out of the city, you're into Washington State and all the natural beauty that came with that. I think, again, for all of us, I mean, the growth has been something that I love to see. And, I certainly have seen the impact of the growth, obviously, on our team members, more team members having to commute from longer distances because of cost of living and all of those things. And so I know that's what we talk about all the time is like how to continue to keep Seattle vibrant and growing and make it a place that is accessible for so many, because, I think that, again, this is home. The potential of this place is just unbelievable, and want to make sure that we're doing everything that we can to contribute to it.
So you've had to take on and respond to and lead through some tough issues throughout the last 8 years, and certainly over the last 3 to 4, including the pandemic.
Yeah.
How has your leadership style, your approach to leadership evolved through these last couple of years? What are some traits or qualities that you maybe had to lean into a little bit more or develop?
Yeah, no, it's a great question. And again, maybe a little bit of just in my own, having, military experience, integrity to me really is the key leadership thing. As a pediatrician, parents throw an incredible amount of trust. It is the most valued thing they have in their life, right? And that trust with you as a provider to take care of their kid, at the end of the day, comes down to, even if things are hard, are you going to do the right thing, right? And so I think for me, it's always been that ingrained of, when things are easy, anybody can do this, right? It's really when it's hard, are you someone that's going to stick to the principles, stick to what is really important, even if there is some kind of personal, part of that you take a little bit of a toll or on behalf of the organization. And so I would say for me, through all of the challenges over the last 4 years, as the kind of representative of Seattle Children's and an organization that, again, I've been here for 8 years. I mean, I am doing this on the shoulders of incredible leaders for 116 years that have made this institution, the reason why so many parents across the region, bring their kids to Seattle Children's, because it is an organization that has been successful, has done well, but it's also an organization that's going to do the right thing. And so I think in the midst of this, it's doing the right thing, but also being willing to admit sometimes when you don't get things right. And, like all of us, we are individually human, and as organizations, sometimes, we have challenges. Are you going to commit to doing what you say you're going to do? Are you going to commit to making sure that you get things right and doing whatever it takes to be able to do that? And I think, for us, being able to weather some of the challenges that we've gone through, we've just seen some more recent reputational scores, it really was about, yes, things were hard, and yes, there were some things we didn't get right, but you stuck to who you are, you stuck to what you believe in, you made the right decisions, and in the end, we're in a better position now because of that.
I like that message of it's sometimes it's easy to do the job and to lead when it's easy, right? But it's when it gets tough and difficult is.
Yeah, and I think it's always interesting, right? When things are easy, you're never really in the spotlight when things are easy, right? And so it's a little bit of
maybe you are, and everybody's telling you how great you are and how wonderful you are, and
right, yeah, no, exactly,
you got it all figured out.
Yeah, but I mean, again, to me, it's you really do show again what you are about and what matters to you when things are hard, and you can't. There's nothing you can say in those moments to do it. It's really going to be about what do you do about it. Like, do you take the actions? Do you get the results? Are you willing to have people come back and take a look and see, like, yeah, did you say and do what you said you were going to do? And I think for us as an organization, that's always going to be, what again, for us, we have to keep that integrity to continue to build that trust with our community.
How do you manage all the different stakeholder groups that you have to be cognizant of? I mean, you've got your board, you've got a workforce, you've got patients, you've got parents, you've got a community around you.
Yeah.
You've got a lot of interests to juggle and balance. Do you think of your world in that way? Do you approach your leadership in that way? Or is there a different sort of orientation you have to the constituencies you're serving?
Yeah, no, it's a great question. And absolutely. I think that's, again, one of the unique things about this job is, it is not just being at a children's hospital or working, here downtown. To your point, we are representing this incredible community. And for us every day, we've got parents and kids and families from Washington, Idaho, Montana, Alaska.
Mm-hmm.
I was just up at the hospital last week and was talking with a parent who had, just driven from Bozeman, Montana, was here to have their kids get taken care of at Seattle Children's. So to your point, I want to make sure that we're staying connected with all of our communities. And, there's a part that I need to do personally, and that involves kind of sometimes making, those trips around to all of our regional sites,
Mm-hmm.
Making sure that we're doing that. But our team members and making sure that, again, part of this is what I need to do. And part of it is, have we set up a team and a culture which really is about centering in our communities and making sure that we're hearing their voices and understanding what are the needs that they have more than just what do we want to go out and do. And to your point, that involves everything from, our faculty and all of our team members, our board, the incredible community that supports us. One of the amazing things about Seattle Children's is, the amount of philanthropic support from community members all over this region and what makes our work possible. There are more events than any of us could ever go to. So trying to figure out how we can be as visible as we can connected, but show that gratitude to all of our friends, our supporters, our guilds that are all over the region, because we don't get to do what we do without that support.
Mm-hmm.
So yeah, that is a massive part of it. And obviously trying to figure out how I can best stay connected, but also with our team, make sure we're doing that.
Do you have any advice for us Seattle parents that are trying to pay close attention to our kids' mental health coming out of this pandemic? Are there things we should be doing, things we should be paying closer attention to when it comes to our kids' health?
Yeah.
Mental health.
No, it's exactly. It's a great question. I'd say the one thing that I'm really optimistic about in this is that kids are willing to talk about this, right? Mm-hmm. We already see a difference even from our generation where there was sometimes such a stigma about mental health that, it wasn't a conversation that, that I had in our house growing up of how was I doing. So my biggest advice to all our parents is just talk to your kids. They're going to be willing to talk about where they're at if you're willing to ask. And I think it's just really important. Again, it's one of the things that does make us hopeful and optimistic is I think we've gotten rid of so much of that stigma. They are willing to kind of talk about that, but they're going to be more willing if we can ask. And so all things, just, taking that time every so often just to check in with your kids and see where they're at. Then if, you get those signals, make sure that, again, we've got resources, how do we help support patients and families and parents that need to be able to do that? But that'd be my single biggest of advice is, as always, sometimes just have that conversation. Even though it may be uncomfortable, most of the time what we find out it's actually more uncomfortable for us to ask than it is for them to really tell you where they're at because they don't see it the same way. We've talked about social media in an interesting way, right? There's that part about normalizing, what is so common that way. And so getting rid of some of that stigma and just being willing to have those conversations.
Yeah, I think that's great advice. I take that to heart with my kids and feel good if we can just keep talking and sharing and opening up.
Yeah.
That's so critical. And they've been dealing with a variety of tough stuff, and they're 14 now, so I won't say much more than that and violate their
No, that's exactly right. Yeah, that's right.
You used to be able to talk more about your kids openly when they're younger.
Always easier when they're younger.
But,
that's right.
But I should say we got some great care earlier today from Seattle Children's. And
nice. Okay,
Dr.
great.
Green there. So
good.
Yeah.
Good.
But, just keeping your kids talking to you is.
Yeah, no, it really is. And again, sorry, it's a really sobering statistic, but just for perspective, we do surveys of 10th graders every year. And, even over the last couple of years, at least a quarter up to half of them, when you survey them, in a confidential way will say at some point they've thought about or considered suicide, right?
Yeah.
And so this is not isolated to one geography, one socioeconomic class. This is all of our kids. They are all struggling. And so being able just to understand that and have those conversations is going to make a huge difference. And again, back to your question about Seattle specifically, like this is a community that I know can get this right. We have over and over demonstrated that, we've got the will to be able to kind of tackle those tough issues for our kids. And so I'm optimistic about what we're going to be able to do.
Mm-hmm. We have a couple of standard questions on the podcast.
Uh-oh.
And the first is your first job that you drew a paycheck for.
My first job that I got a paycheck for. Oh wow, this is a great one. So I again, obviously Gen X kid, getting onto computers for the first time. So I actually built a database for my school when I was I was probably ninth grade or something like that. Got a summer job doing some of that.
You remember what kind of computer this was? It was like an Apple IIc Plus.
No, so I had a Commodore 64 at home, but it was a little bit more advanced at the school, exactly. But yeah, no, I really do. There's a little bit of this that's kind of fun for me. Microsoft, had a huge impact on me as a kid growing up, and so it's kind of nice to be here and be able to be in the community where it all started.
Yeah. And then we conclude our podcast with another standard question, which is, what's the itinerary for your perfect Saturday in the city of Seattle? What are you doing if you could design your perfect Saturday?
Oh, that is an awesome question. I'm gonna again back to we love living in Ballard, so some of it, some of the best days can just be hanging out in Ballard in the village. But love coming down by the waterway here in downtown Seattle. So I know it's a little bit cliche, but coming into Pike, being able to spend a little bit of time here along the waterway for us is a really good Saturday. Yeah. Yeah.
And it's only going to get better,
It's only going to get better. I'm going to say this. We had the privilege just last month of hosting the International Children's Hospital CEO Conference, and so these are CEOs again from the top children's hospitals all over the world. They picked Seattle to come to do the meeting, and they were just blown away.
So the pressure was on you.
The pressure was on them. Yeah, exactly. No, right. Set up all the right venues and the events and everything else. So, we did some of the standard stuff. Obviously, Space Needle, Chihuly.
Yeah.
Some of those things, but got out on the water a little bit, did some wine tasting, some of that. They were blown away. But again, what was fun for me is the number of them that actually came in early and had already been out and about exploring the city even before the meeting started. So, to your point, it's really cool when you can absolutely not only be proud of your city, but be able to show it off and just see how much people really are just blown away by this place. It also makes you a little bit, again, just reflection of how fortunate we are to get to live here.
Yeah, sometimes it's nice to see it through outsiders' eyes.
That's exactly right.
To reappreciate the things we might take for granted.
Yeah, no, that's right.
Yeah, we're bringing our professional association, the International Downtown Association, here in September of 2024. So we're looking forward to showing downtown off to 1,000 plus downtown practitioners.
Exactly.
And we'll make sure they know of the significant research footprint and activity that takes place downtown through Seattle Children's, among others.
Exactly. No, happy to help. And again, obviously, got the Major League Baseball All-Star Game coming, this week. And so, I think we're in a really good place. I appreciate everything that you all are doing to help support. Obviously, love the partnership and collaboration. Really good days ahead for all of us. And so just want to make sure we're all doing everything we can.
Yeah. Couldn't agree more. I think our best days are ahead of us and great progress. Well, thanks for making time, and thanks for what you're doing and leading a incredible institution that we, I know, are all proud of, and proud to have downtown, proud to have in Laurelhurst, and proud to have serving the 4-state region. Sometimes we take the incredible healthcare in this community for granted. Yeah. And when we need it, it's there, and we all benefit from it. So you don't have an easy job, but we're grateful for what you do and how you lead.
Sorry, I have a great job because I have a great team. And to your point, like the work that we get to do every day, and we are always here. That's part of what makes us. And appreciate the chance to be able to do this.
Well, hope you enjoyed my conversation with Dr. Sperring. Really appreciate him making time to come on Seattle City Makers, and so appreciative of having the incredible care that Seattle Children's provides in our community. Can say that as a parent who's accessed and used Seattle Children's care previously, and I know any parent listening that has the fortune to have the care that they provide in our community would agree. So grateful for all that they do, and proud that they're downtown with their research functions and leading cutting-edge research to save kids' lives. It's pretty cool that all of that is happening in the heart of Seattle. So thanks again to Jeff for making time to join us on the podcast. I want to close out with a couple of recommendations of things you can't miss downtown Seattle, things you got to check out this summer. And the summer is trucking along. We're already in the middle of July here, and boy, we've had a great stretch. So make the most of it and get out and check out some free concerts in downtown Seattle. The Downtown Seattle Summer Sounds concert series is in full swing. 37 free shows throughout the summer, July through September, in parks and public spaces throughout the downtown. We kicked off with Umi just a week ago or so with a couple thousand people on Pine Street at Westlake Park. It was quite the show, and it was great to hear cheering in the middle of downtown Seattle. And there's plenty more where that came from. The Cave Singers, Helio Sequence, Star Anna. It's a great list of live music in downtown Seattle this summer. You can find out all the details at downtownseattle.org. And I also want to lift up and highlight Home Team, which is a restaurant, retail, event space, museum that took over the former London Plain space in Pioneer Square over there on Occidental Avenue. I was by there during All-Star Week. The doors are open. This is brought to you by Seattle restaurateur Marcus Lalario, in partnership with some of Seattle's elite athletes. I don't know if those elite athletes have been named yet, but there's a number of folks behind this pretty cool concept where they're just mixing a bunch of different things. Italian fare from mezzanotte, coffee. There's a gallery, a 4,500 square foot restaurant, event space. It looks pretty cool. And Lalario is behind Little Woody's and the Central District's Fats Chicken and Waffles. He's an owner of clothing brands Alive and Well and Can't Blame the Youth. So he's got his fingers in a number of different ventures and has cobbled together a bunch of different things in this gorgeous space that the London Plain used to operate. So go check out Home Team down in Pioneer Square. Well, thanks for listening. Please drop us a rating, a review, subscribe. We love your guest suggestions as well. Seattle City Makers is presented by the Downtown Seattle Association with support from James Cito and production by Spark Creative.